Thank you. All right. Our next panel is we want to look at wellness and action models in the field. And so I want to welcome up Cassandra Licknock, did I pronounce that correctly, from the Chief Operating Officer at CalSTRS. Welcome. And Teresa Chagoya, Manager, Santa Clara County Employee Wellness Department. So, and then we also have Tom Traylor, Chief Executive Officer at RXTE, which also actually does wellness for Safeway. Yes. So welcome all, and we'll start off with Ms. Licknock with CalSTRS.
Right.
Welcome.
Thank you, Dr. Pan, and good morning, members of the committee. Thank you for inviting me to speak to you today on achieving employee wellness in the workforce. I'm Cassandra Licknock, the Chief Operating Officer at CalSTRS. A growing body of research indicates that wellness programs positively influence employee behavior in the workplace and workplace productivity. In an employee engagement and satisfaction survey, 86% of CalSTRS employees indicated that it was important to them that we promote health and well-being in the workplace. CalSTRS views employee wellness as an extension of our core values and as an expression of our sustainable culture. Sustainable wellness objectives, such as our Be Well at CalSTRS program, are integrated into our everyday business practices at every level of our operations. We believe that a sustainable employee culture promotes an engaged employee culture, reduces absenteeism, and encourages employee retention. CalSTRS values our employees as active partners in these efforts. To ensure increased engagement in our workforce, we have instituted wellness programs in our workspaces, built it into our building's foundation, and encourage it in our lifestyles. We offer an on-site wellness coordinator who facilitates and markets our wellness initiatives, along with a wellness committee made up of representatives throughout the organization. On every floor, we post information and updates on activities and themes, including smoking cessation and weight loss programs. CalSTRS headquarters maintains a LEED Platinum certification, where we harness the natural light for illumination in an open space work configuration. With limited closed offices, there are views of the Sacramento landscape from almost every workstation in the building. Our building is adjacent to the Sacramento River with access to the Riverway Parkway. By benefit of our location, we can promote a healthy lifestyle. Employees, including myself, often use the 1-mile walking loop around the River Parkway walkway. And our headquarters facility includes almost 5,000 square foot of fitness center space with lockers that include cardiovascular strength equipment and strength training equipment, also a yoga studio. Employees have free access to the fitness center through extended workday hours and weekends. Bicycle commuters are afforded lockers so that they can store their personal items in support of those who employ alternative transportation. And this, in part, has helped us reduce conventional car trips to the building, which helps our alternative transportation goals. We also operate a bicycle library with 8 bicycles with helmets and locks so that employees can check those bicycles out during their lunch times and break periods. CalSTRS encourages physical and mental wellness by providing 3 walking workstations in designated areas of the building. Catching up on emails and participating in conference calls or doing anything that you would normally do on a computer in a day-to-day work activity can be done in these walking workstations. Our sustainable culture cascades into healthy choices in many other ways as well. In October of 2015, CalSTRS became one of the first state agencies to promote a farm-to-fork lifestyle when we broke grounds on CalSTRS Waterfront Gardens. This small-scale urban garden is maintained by our Waterfront Cafe employees, which is our on-site eatery. Organic, seasonal produce is used in a variety of dishes available to the CalSTRS employees and visitors who visit the cafeteria. The Waterfront Cafe also provides a host of healthy options with the organic produce and publishes calorie counts in many of their menu items. We also participate in community-supported agriculture, a weekly produce delivery service from Say Hey Farms. The farm delivers boxes of local and organic produce that is reasonably priced and grown in Yolo County. CalSTRS also promotes a variety of other ongoing programs. In addition to the 63 blood drives and Weight Watchers at Work program, we host Lunch and Learn lecture series and annual employee wellness fairs. Our Top Loser program promotes healthy weight loss through a 12-week challenge, and activity-oriented competitions like Stair Wars and Step Jockey also encourage the use of our stairwells. So Step Jockey, for instance, is an interactive activity where there are QR codes posted at every level of the stairwells, and you can download an app and go into the stairwells, scan what floor you're on, and then it'll track how many floors you walk and how many calories you're burning. So right now, the current activity or challenge is that there's teams of 5 employees where they're competing to scale different, the highest buildings in all around the nation. So that's always exciting. As a matter of fact, there can be quite a bit of a traffic jam in the stairwells now, which frees up the elevator, so that's good. In 2012, CalSTRS participated in the Blue Shield-sponsored Bill of Good Health pilot program commissioned by PERS Health Benefits Committee. The Bill of Good Health program encouraged employees to assess their current health status, promote healthy goal setting, and increase their activity level through biometric screenings and run-walk programs and a variety of other activities. 622 employees participated in the program, which was a 73% participation rate at that time. At any time, our employees can learn more about our Be Well at CalSTRS program by our internet, where they can also find preventative tips, healthy recipes, inspirational videos, and a guide to other wellness resources. CalSTRS strives to be an employer of choice, and as such, we have an opportunity to encourage the health of our employees. Our wellness program is more than diet and exercise. It serves the gamut of wellness factors from environment to disease prevention, mental health, food choices, and education to general awareness. Thank you again for the invitation to present to you today, and I'd be happy to answer any questions that you may have.
Okay, well, thank you. I think what we'll do is we'll have all the presenters and we'll have questions at the end, if it's all right. Okay. All right, thank you so very much. So next, Teresa Chagoya with Santa Clara Employee Wellness. Welcome.
Yes, thank you. Thank you for having me today. I'm happy to be here to talk about our County of Santa Clara Employee Wellness Program. Just a little bit of history. We have a legacy program. It was in place since the early 80s within our public health department. It's since moved over into our Employee Services Agency, where it sat for a number of years under the Risk Management Department. And then around 2009, our Board of Supervisors, particularly one of our supervisors who had an interest in improving employee wellness, sent in a referral. And the referral was really to see how do we grow this legacy program into more of a robust, integrated program with other departments and whatnot. So around 2011, they moved that program, and where it sits now under the administration of our county-owned and operated health plan, which is Valley Health Plan. What we did initially is we did hire a wellness consultant to take a look at the program to see where exactly we were going to be, what we needed to do. We had a program in place, but we really didn't have an overarching strategic framework by which we needed to move forward some of our initiatives. So we decided to work on that, and underneath those particular framework phases that we have individual objectives. So objectives around the individual. What do I as a person need to do to maybe increase my awareness about the program? How do I increase my accountability towards my own personal wellness, as well as for the sustainability? How do I sustain this over time? Organizationally, also during those 3 phases, we have organizational. What is the organization doing to increase my awareness? What are we doing to increase accountability of the organization to make sure the employees are healthy and well? And again, sustainable. How does the organization improve and implement policies so that you can sustain that over time? So we took that really towards the bigger goal of creating a culture of wellness in the county. We do have about 17,000 employees in our county, over 100 different facility locations, multiple departments, so it was quite a challenge. In addition to that, we added a full-time manager, I'm that manager, and an analyst. We already had 3 existing health educators on board, so we had a staff of about 5 right now. We created a cohesive branding program, which is a little bit of what we felt was lacking from the last program. Cohesive in that you're knowing who it's coming from. There's a new logo, a tagline. So you're looking to see this as a great marketing component, and communication part to it. We also started a team, what we call Team Well. Our Team Well is a coalition of our benefit providers. So we had the medical folks, which was Kaiser HealthNet Valley Health Plan, Delta and Liberty Dental, as well as VSP, which are our vision program. We had our benefits folks and our labor relations folks who were involved with that particular committee. We met together initially and basically said, this is where we're going. Are you coming along? Let's come and support us. And they did. So it's been about 3 years now. We meet almost every month. This group comes together. We talk about what's going on, what the strategy is, and how we can work together to support the wellness of our employees, since it's really in both of our best interests to do that. We have, at that time, also worked with our executive leaders, making sure they, of course, knew where we were going, talked about the strategic framework with them, and how we were going to move forward with this over time. The other piece that we did is we implemented a baseline survey. So we really didn't have a lot of data. Even though we've been in place for a lot of years, it was kind of sporadic data. We did a baseline county-wide survey that went to county employees and got a really good representation of each of the departments, in which we looked at that over the last 3 years and have benchmarked against not only the data that we've had, but also county-wide data. So looking from the public health department and looking to see how do our county employees compare to the overall county population. We also have a wellness champion network. So this is something we started over the last couple of years. And has been extremely successful. Again, 4 or 5 employees, 17,000 members. We can't be everywhere all the time. So our liaisons are volunteers within the departments because we did have the overt, support from the county executive level. Our managers allowed them to come in as appointed volunteers. We meet monthly. We have a call to action for all of them. So they come back. They really provide the communication and the foundation of our program. What are we getting out? What do we want to make sure they know about? And then they themselves take it a little bit further. Many of them have their own wellness things that they've done. They all know their own cultures. We can't know, from the agency to the department to maybe a unit, what a microculture might look like. So they have the pulse on that and are able to provide and to do the services of a wellness champion and with our support, so to be able to help them with that. So we have that available. We also are working right now on an online tracking system. So for folks to track their progress from the campaigns that we do. I'll talk a little bit about our program components, but that's one thing that we are very excited. It's an in-house campaign. It's not something we're purchasing, so we're working within our means of our IS department, our Information Services Department, to provide that. So the components that we have right now, physical activity is always one. We have 2 countywide campaigns that we have per year that it's open to everybody, and we have on the high end about 2,500 employees that participate every year on each of those campaigns. We have 15 to 18 fitness classes we offer per week for employees to participate in, so they can go, and they're located at facilities around the county, so we try and get out there where they are. We have the promotion. We promote external events, so like a turkey trot that supports our food bank, or ones that Heroes run that is through the sheriff department that supports our pediatric department. Those are the kind of things that we encourage our employees to go out and register, and we try to help them form teams and prepare for that. And we also have a health club directory. We don't specifically contract with health clubs, but if they are willing to offer us a discount, we provide that facilitate that for our employees. So we don't have any physical locations like a gym on site at any of those locations, I think, except for the public safety folks. But we encourage them to go to use wherever the facility is that they have that's closest to them. Again, nutrition, we do have CSA boxes they're unsubsidized. We have a nutrition and catering policy, a countywide policy that was in place from our public health department that we promote. And then one of the activities that you might have seen in that newsletter, we have celebrity chefs and things that come in to teach people about cooking healthy. Education, we do a lot of education with our benefit providers. They come in, they provide classes for us on site. We have, there's about monthly that we do. We have a campaign that we do every year on preventive services in collaboration with our benefit providers, again, to teach people into their services, preventive services. Events, we have events every year. We have 4 health fairs that we move around to different locations so we can get access to other locations. And we offer biometric screenings as a volunteer. Again, our benefit providers pay for those biometric screenings for their members. Safety seminar, bike to work. We offer flu shots. We work collaboratively with our public health department and our employee health department to offer flu shots to our employees. So we move those around. Emotional wellness, we are doing this year is, you work on the physical, but you also on the mental, so stress management, resiliency. Are you sleeping well enough to come out to work and be productive? And then the marketing. The marketing is huge for us. I think that's the biggest piece that we do, is really to get out. If you have a great program, but if people don't know about it, they're not going to participate. Lastly, challenges that we've had, I think a lot of it is really engaging, the executive level. They support it in theory, but getting folks to participate is a different story, especially on the executives. It makes you a little bit more vulnerable. So, having them come in and really be participants in a lot of these programs we do. And then the management support, which is something we're going to be addressing this year, getting folks to actually allow employees to take the time at work to go to some of these seminars, to take a class, I think has been a challenge because it's hard when you're day-to-day and you're dealing customer service and you're an hourly employee to get folks to allow them to go. So that's another one. And just being nimble. I think that, we all have these big programs and you have a foundation program, but being able to say, okay, I'm going to adjust to what my employees are telling me either in our evaluations or in our annual survey so that you're serving them. You're not just serving yourself, but you're really addressing some of the needs that they're looking for. So thank you very much.
Thank you. Wonderful. Yes. So, Mr. Taylor.
Good morning. My name is Tom Traylor. I am the CEO of RXT. Chairman Pan, appreciate the opportunity. The committee members appreciate the opportunity to speak with you. So RXT, you would know us actually in our earlier form. We were Safeway Health. We were a subsidiary of the grocery store chain Safeway. Safeway's had a very long journey in wellness starting in the mid-2000s. And Safeway Health was created to assist Safeway with their internal journey and then also help external commercial companies and the Taft-Hartley Labor and Trust Market on developing their own wellness programs as well. And so over the course of starting in 2005 and here we are in 2016, we've had the benefit of basically trying just about any wellness program that you can imagine and then having them for a long period of time to see the results. And so we're now at a point where we can target focus depending on the organization, what their needs are. And really what it does is it shows wellness over time. The programs that are immediate ROI versus the programs that are long-term ROI. And I say that because what I'm going to talk about today is what I think the most important part for getting any real value out of wellness programs is you have the first part, which is paying for wellness programs to begin with your immediate ROI programs, and then the long-term programs on affecting member behavior and affecting member health. And fortunately for being last, everyone has talked about why we need to do this, given all the statistics on what we're seeing now, how sitting at a desk is now the new smoking. And we have, Safeway in the mid-2000s had the same type of numbers that other people were talking about. We saw that the average diabetic was around $3,000 additional per year. We saw that, the numbers that were given before by CalPERS where 25% of the population was generating 50% of the costs. For Safeway at the time, it was more of the 80-20 rule. 20% were generating 80% of the costs. And the end state being in the mid-2000s for Safeway is that their healthcare costs were growing at 8 to 10% per year on a $100 million spend. And for a grocery store company that has 2 to 3% margins, it's unsustainable. And so something had to be done very early on. We actually looked internal, and I say we because RXT was Safeway for all of those years. We looked internal to develop our own programs because while we didn't know anything really about healthcare, what we knew is how to evaluate consumers and how to turn people into consumers. And our idea was we're going to turn our members into consumers of healthcare. They are going to be able to make decisions about purchasing healthcare, purchasing the prescription drugs that they're going after, and so that's where we started with our focus. The end state for Safeway and the effect of this is that while the rest of the country again was trending around 8 to 10% in healthcare cost growth from 2005 to 2012, Safeway was actually trending at 1%. In 2013, they were negative 2.9%. In 2014, they were negative 9.5%, which shows the value of wellness over time is that, sure, there might be some years that you have to devote to it before you see the return on investment, but clearly the Safeway model will show you that the investment is absolutely, the results are there. So with that in mind, I want to focus specifically on one program in particular that has been really the banner program for Safeway that has started them on this path and then kept them on it, because it's provided an immediate and consistent ROI, and it's got a high participation rate based on, and you'll see based on the program. And I'll add really quickly that Safeway in general has seen an 80+% participation rate in their wellness programs, and that again goes back to having experience in turning people into consumers. So model programs in general, you want to ensure that they are hitting the primary cost drivers, which, Chairman, you said it earlier, that these cost drivers being behavior-based, where 80% of, healthcare cost expenditure is based on just behavior-based and individual decisions. So that's where we started our focus. You want it to be what we call weighted wellness, or what's commonly referred to as carrot and the stick. Everybody needs to have skin in the game. That's something that the representative from Kaiser and actually the representatives from the other panel had said as well, is that you want to have skin in the game based on both labor and management. And the value that we saw internally to having skin in the game with our employees and our management, which then translated out into the actual USCW market, the labor market that supplies employees to Safeway. We were able to work with our unions as well, and actually represent over 500,000 members, and get that balance between the management and labor, so that they both are backing the programs that you're putting forward. And of course, critical to any program rollout is ensuring that you have executive level sponsorship, and the highest levels that you can being involved with the program. If leaders are not involved, then why should anybody else be involved, is common sense. So Safeway's journey, I tried to count all the different programs that we did, and I stopped counting at 31 because there were so many more programs to go through, and I thought I can't come up here and talk about 31 individual programs. Everybody would either fall asleep or just walk out on me. So targeting the programs that really drive that immediate ROI, that keep sustaining the wellness programs. I want to talk about one in particular that I think is appropriate in the current environment, as we see and we hear in the news about the prescription drug costs increasing. We see what certain manufacturers of drugs have done with their pricing, increasing at 3,000%. There is definitely a critical point in the market today on prescription drug pricing, and the program I'm going to talk about that really was a boon for Safeway was their they call it their MPD program, which is Market Price Drug Program. And the end state of this program is that you start with what is the clinical outcomes for these chronic conditions, and then you determine, based on the universe of drugs available for your members, what are the lowest cost options that have similar or equivalent clinical outcomes. The effect of that being is that while in the marketplace, generic drugs are trending up actually higher than brand drugs, they're trending at 18%, brand drugs are trending at 9%. What you're able to do is constantly review and adjust members to ensure that they have the opportunity to always maintain that they are on the lowest cost medication available to them year over year. The benefit of that is not only the healthcare savings that I'll explain, but it's also adherence. What we found is for the people that were the least adherent, which is generally the people with the highest medical cost in general, are also the least adherent. Those that were between 0 and 10% adherent, once we were able to get them on the lowest cost medication, they became 90% adherent, because it wasn't a decision for them of what medication can I afford month over month. The savings in general, and this is savings in two capacities. It's savings back to the plan and savings to the member. What Safeway saw year over year was $8 million in savings for a benefit eligible population of between 23,000 and 30,000, and which equated to roughly 33% So year over year, Safeway was saving 33% on their pharmacy costs in chronic non-specialty categories, which they were able to take that money and use that as the funding for all of their other 31 plus wellness programs that got Safeway over time to the negative 2.9% trend in 2013 and the negative 9.5% trend in 2014. Going back to that specific program in general, to give you an example of a model program, the objectives were simple. We want clinical, we want equivalent and similar clinical outcomes, but we want to keep people on the lowest cost medication. An example being, everyone's familiar with cholesterol medications. 50% of Americans over the age of 50 are on these drugs, and you can be prescribed Lipitor, generally what's considered a tier 2 drug, which means that if you have a $10, $20, $30 copay, the member's going to pay $20 and the plan's going to pick up the rest. That drug is roughly $180 some at any given point. The direct generic of Lipitor is a drug called atorvastatin calcium. It's the exact same chemical combination. At this point, we're all very aware that there is little reason for people to be on brand drugs, and so we are all have seen information, and CalPERS actually has a program that I believe is called Members Pay the Difference, where they incentivize members to switch to that direct generic. So in the Lipitor example, that's $182. Atorvastatin calcium is anywhere between $14 and $20. What Safeway determined was, again, being a grocery store company that owned pharmacies, is that they knew drug pricing, and they knew that if you were going to take a cholesterol medication, Lipitor 20 milligrams or atorvastatin 20 milligrams, to affect your LDL cholesterol level, there is a lower cost therapeutic alternative called simvastatin. It's the generic of Zocor. Simvastatin at that time was $7. So you can imagine going from a drug that was $182 to a drug that was $14 to then a drug that was $7. The difference for the plan became, before, if the member was paying a $20 copay, the plan was paying $160 for Lipitor. If the member was paying a $10 copay for this tier 1 generic atorvastatin, the plan was paying $4. Now the member is on a $7 drug. The member saves $13 from the Lipitor drug, $3 from the generic drug, and the plan saves all of that money because it's now a $0 plan responsibility because the drug is under the copay for the member. So the end state being, every time that drug was prescribed, whether it was Lipitor or atorvastatin, the plan and the member were saving money, and the numbers turn out to be, on average, when you run these types of programs, you're going to save 21 to 23% for the plan and 12 to 15% for the member. The end state being, every time a prescription is filled, there's just savings generated that can be used towards other wellness programs. How this program has changed over time to ensure that it stays fresh is that you have to we refresh this program every year for Safeway to ensure that their members always have the opportunity to get the lowest cost alternative. End state being, again, immediate ROI program that will affect the spend for the plan that they can then reinvest back into wellness programs, which show that while Safeway, everybody else was trending at 8 to 10%, Safeway ends up at a negative 9.5% because they were able to fund these wellness programs over 31 that everybody has mentioned before, that then got them to the negative trend.
Okay, well, thank you. Thank you so very much, everyone. Questions from committee members? All right. So I just have a few questions. So again, I want to thank all of you for your presentations. I guess my first question is actually in terms back to valuations. So we heard from CalSTRS about some of the great activities going on over at headquarters across the river in my district. Thank you. And then also from Santa Clara as well. I heard about a lot of different activities. And I know Safeway's done evaluations. I've seen some of those. So I won't ask you but for right now. But I have a question for you later. But can you speak to perhaps what kind of valuation are you doing on these things, and what kind of results have you gotten in terms of whether it's cost or also better health outcomes. So if you engage someone to do an evaluation, have an evaluation been performed? So perhaps we'll start with Elsters.
We do evaluations on surveys with our employees on their participation rate and what they've personally derived from it. We haven't done. We're not assessing the cost of whether or not their biometric screenings have resulted in them not, saved any absenteeism. That was done primarily from the PERS Health Committee. That's what their primary goal was. So we do it through just interactive surveys and what their desires are and what they're wanting us to pursue.
So you haven't gotten data back from either PERS or the health plans in terms of maybe changes outcome. Okay. Is that something you might be interested in?
Yes.
Yeah. All right.
But we're small in scale.
I realize, yes.
It's harder because we're only 1,000 employees,
right,
and we're not as huge as these companies. So, but absolutely would be very interesting.
Right. Excellent. In Santa Clara?
Sure. So we do evaluations every time we have a program. So we do more program satisfaction, how our people are participating. We do like a post and pre and post. How are your physical activity before, physical activity after, consumption, that kind of thing. We do, with the annual survey, we ask them various questions from perceptions to participation to satisfaction to, their own, how do they perceive their own health from year after year.
Okay.
So we do look at those across from our benchmark time when we did 3 years ago to currently. You can see some of the trending there. Specifically, we look, and I know I'm going to highlight this for our wellness champions. So you can see the difference a wellness champion makes in a lot of these employees' lives. For instance, I'll say one thing I know for around awareness. If you look at the general population around awareness, say for our programs, if you look at it overall, we had about 88%. We went from a 53% when we first started up to an 88% of awareness of our program. If you look and stratify out those people who say they have a wellness champion, it goes up to 98%. So your wellness champions have obviously made a difference. So those are the kind of folks that if you look at evaluating, how do you evaluate what the engagement is based off of what's happening and how they're getting the information versus a lot of the the baselines. We do look at claims data, which we provide to our board of supervisors a year on annual how we're looking as far as what our focus is going to be for the next year, but not so much on the financial part to it. We look at more on the engagement.
Okay. So we heard some testimony about its impacts on we can reduce on workers' comp costs, on healthcare, although they said lagging, some other absenteeism. So I was wondering whether the county looked at some of those in terms of you made investment in hiring the wellness coordinators and so forth. What is are you able to demonstrate some improvements compared to similar counties or similar populations? Whether that type of examination has been done.
Right. We haven't done so much that. I think a lot of what we do is really, you said, it's hard to determine on a return like that because your population is changing. If you took a population exactly the same and you look at them a few years later, then you have the apples to apples. But you have so much fluctuation in the number of people coming in. You may have a high engagement for folks, but then you have the I'm trying to think. When folks are coming in and out of the county, so we haven't really done that. We've looked, we've looked and we talk with other counties for sure about what their engagement rate is, and it's difficult. We're at 17,000 employees when folks are at 1,000, so it's a little bit harder to evaluate that. So
okay, well maybe PERS can help out if you're all in PERS. So.
Thank you, Dr. Pan. We are measuring engagement, like I said before, but I do think that there are some quantifiable analytics that you can match to looking at the history on whether or not your absenteeism in your general population of employment has gone down if you're trending it year over year. So you can look at that, look at your workers' compensation. We haven't gone that far yet. I mean, I think that it's something that we can do because we have really focused on the engagement ourselves, and we do have a high participation rate and ask the employees what they like to participate in. And in general, in our general population, it is very low. So, but I do believe that there are quantifiable metrics that you can draw from it.
And actually, Mr. Traylor, I know you focused most of your testimony, and I realize our time has been brief, on how you sort of generated the revenue. And certainly, I've worked in my own district on and worked with people on trying to improve medication adherence as one of the approaches to reduce healthcare expenses as well. can you speak to perhaps in terms of that longer term, because you spoke to the immediate ROI that you're getting from the medication. I'm sure it provided also a longer term ROI as well, but some people would view that not so much as wellness as better health management.
Sure.
Can you speak to your ability then to invest long term in wellness and the returns you've been able to get on more, I guess I would call it traditional or more what people would consider wellness type programs and helping that trend down that you were able to achieve in Safeway?
Yes, absolutely. And that is the distinction. You have your cost saving programs and your wellness programs, and wellness can blur the line of both. So, of the 31 plus programs that Safeway had implemented, and if you think of it as a traditional wellness, one of the key drivers I would say would be the biometrics program in general. And it's one that we've been doing for, I want to say since 2008 and maybe even sooner. And, kind of what you were referring to is that we were able to look over a 5-year period at the same people who were doing biometric screenings, the exact same cohort. And we were able to gauge their success. Now, Safeway's biometrics program, it is designed to be the numbers that each individual member is shooting for is easier than the percentages that are normally recommended as a healthy BMI or a healthy cholesterol. So those numbers are easier to attain. And Safeway does apply a carrot and the stick model, meaning that if you pass to a certain degree, then you get money off of your premiums that you're paying. Now, of course, for any of these programs to be beneficial, everybody needs to be involved. And in order to do that, you need to have very well-developed, reasonable alternative standards for those people that have chronic conditions where they're just not going to pass any of these programs. And those reasonable alternative standards allow them to then achieve the same incentive so that they can also get money off of their premiums as well. So in state, over a 5-year period of looking at the same individuals, we saw a 21% increase in the passing rate for those individuals for BMI. 37% people stopped smoking of those groups. 51% improved their blood pressure, 63% their cholesterol, and 38% improved their fasting blood glucose. And really what that ended up doing, and I want to make sure I get the statistic correct, but it negated 4 years of aging by the health outcomes that they generated by passing their biometrics program. So it was a very valuable program, but a biometrics program is not something that you're immediately going to see results for. You need it to happen over time, so you need to be able to invest that time into it. Hence why I wanted to focus on the immediate ROI that can fund those programs.
Excellent. Okay. All right. Any other questions? Senator Moore.
Teresa, I just would like you to pass along my greetings to Supervisor Ken Yeager.
Oh, yeah, he's our wonderful champion that really has championed the whole program itself and supporting it. So I definitely will let him know.
And then, Tom, you mentioned a 4-year extension of life expectancy. Is that do you have a defined benefit pension plan and an actuary that calculates?
It was. As soon as I said that, I said I should have the backup for it. But no, what it was really.
Well, actually, because we don't want our employees to live longer.
Well, actually, what it was.
You don't understand. You're sitting next to someone who knows.
Speak for yourself.
Just a joke.
For our perspective, it's this is how you keep people in the office. But it negated 4 years of aging. And frankly, when 37% of people quit smoking, and smoking being $3,400 per smoker every year is added, that's how much a smoker costs additional, is $3,400 a year. And we have 37% that quit smoking because of a biometrics program. I got to sit in on, actually I ran it, a program where we evaluated, we brought in a bunch of people that volunteered to come in and talk about their experience with biometrics. And it was an interesting perspective of some of them saying, I thought originally that this is absolutely none of your business. And that's 100% true. And of course, we don't see the results. We just see the aggregate results. But the end state being, we talked to so many individuals that said, I didn't realize that I was pre-diabetic. We've all heard these stories. I didn't realize where I was on my journey and that I was actually this unhealthy. I thought I was fine and maybe just a little heavy. And the end state for them was of those individuals, they lost on average of 4 pounds per year over the 5-year period, which is significant. That's a significant number. So, negating the 4 years of aging, increasing all of the people passing that incentive, but being able to provide it in a way where everybody can earn that reasonable alternative standards to earn money off their premiums. It's a powerful approach that has both the carrot and the stick model.
So are you wearing a step meter on your belt?
I am not, but I'm running the San Francisco Marathon at the end of July, so I'm close.
Okay, fine.
Okay. All right. Any other questions? All right. Seeing,
Excellent hearing. Thank you. Mr. Chair.
thank you. And so again, thank you all for your presentations, and it's been very informative. And again, appreciate go forth, and appreciate you presenting the wonderful things you're doing. Thank you so much. Thank you. All right. So we're now going to open up for public comment. If you want to make a public comment, please. It's probably too late to sign up with Sergeant, but is there anyone public comment? Seeing no one. So I just again want to thank all of our presenters for being here. I really appreciate it. It's been very informative. Appreciate the very helpful information that we've received today. I think there's some things for us to do as a legislature to help out, but also I also heard very much the importance of the collaboration between both the employers and the employees, and the important role unions play as well, and getting people engaged, as well as, of course, developing and designing the program so that people are engaged. I think those are all very important lessons. I think we do need to do some work on evaluation. I will actually just briefly comment, in setting up this hearing, we were seeking someone who could be an expert on wellness evaluation. While we have wonderful models that have been out there, apparently there's more research that needs to be done as well. So I hope that everyone who does that gets their evaluation program. And I heard the testimony about we need to get some money for that as well. So we'll see what we can do about that. But again, I want to thank everyone. And again, thank you to all the members who are here. And with that, we are adjourned. Thank you.